Welcome to Trulyfit, the online fitness marketplace connecting pros and clients through unique fitness business software.
Nikki, thanks for being here with the Trulyfit Podcast. Can you give the audience a background on your fitness life and your career, your credentials, and what you do in the fitness world?
Thanks for having me, Steve. So yes, my name is Nikki and I am a Pilates instructor, mama of two, and I have been in the fitness industry for a long time. I'm not going to tell you how long necessarily because it's going to age me, but basically I was a former dancer, turned Pilates instructor through an injury when I was in my mid-20s and fell in love with the movement modality of Pilates, used it to heal my own injury so that I could get back to performing and traveling. And I fell in love with it. And so it's been, you know what, I'll just tell you, it's been over 20 years. So it's been a really labor of love, really. So I'm, like I mentioned, a former dancer. I'm Stott trained Pilates instructor, but I say that because, you know, that's where I originally got my certification. But I think people need to know that in fitness, the best trainers continuously keep learning. So I did my certification maybe 15 years ago now for this particular type of movement modality. But then there's been dozens of other courses and workshops and whatnot beyond that. I also have a mentor who's a PhD and a researcher at the local university here. And I live in Toronto, Ontario. So there's a lot we need to do to keep learning, I think, to stay on top of our game.
I couldn't agree more. I'm also Pilates trained, but my background in Pilates was I was forced to watch 500 hours of reformer training. I assisted during that time, but I never actually did a one-on-one until I made my 500 hours. Mm-hmm. And it was fantastic. I learned so much then that I still use to today, as far as like cueing and the verbiage that was associated with it. And I love it. And people in this podcast, unfortunately, I've heard me talk about it too many times, how I believe that all trainers should have some sort of background in it, because it's also important for all ages, all demographics, right? Whether you're working with a young mom or whether you're working with a 76-year-old, there are things and movements in Pilates that are important for you to understand that you can use in all genres. But not to go down a huge Pilates tangent, because I've done that on other episodes before. Let's go into a little bit more about you. I want you to tell the listeners about your bump method.
Sure. So the company's called the Belle Method, and it started out, Belle, I'm half French, beautiful method. That's the name, essentially the inspiration. But it's a way of fusing Pilates with dance choreography, yoga, dance conditioning. And then it eventually started incorporating more pelvic health because I saw the need. And really now it's really Pilates meets pelvic health. And then the bump method is a division within the umbrella of the Belle Method that really focuses on pre and postpartum women. And I realized that there was a huge need because I'd had more and more pregnant women come to my group classes, and I have to modify for them and offer them, additional cues, and they'd be having issues. And so I thought, you know what, let's make something specific for you as a pregnant woman. And then of course that eventually led to postnatal. So it all happened quite organically, I have to say, just from recognizing there was a gap in the needs that these women were having. These women were coming to me, and, I'll tell you a quick story just to illustrate this. I remember, and I've taught everything. I've taught step class, swim aerobics, spin class, Zumba, boot camp. I've taught everything, not just Pilates. So just people, so they know that. And I was teaching a boot camp outside. This is before I had two kids, and I was in my mid-20s, and I remember doing a ladder drill. And I think about I'd say 85% of the women in that group were older than me. They all had children, and they were like, "Oh, I can't do that." And I was like, "What do you mean?" Totally naive. They're like, I can't jump like that. And they'd laugh. And there was like a mutiny. Like I'd say probably like 60% of the group basically refused to do that one move. And they were like, oh, it's because I'm not wearing a pad. I'm going to pee my pants. And I remember being like, what? Is this a thing? My naive 25-year-old self. And it really, I think in that moment was a catalyst. And I realized that, wait a second, these are women. They're not that much older than me. And yeah, they've had a kid or two. And so many of them are having this issue. And of course, I'm a nerd, and I immediately wanted to dive in. And I already had my Pilates certification at the time and was still doing a variety of different fitness modalities. And I thought, I really want to get to know more about pelvic health. This is an issue. And I can't imagine if they're 40 and they're having this issue, it's probably not going to get better when they're 60. It's going to get worse. So what can we do preventatively to either reduce or prevent it? And what can we do to really help it if it's already happening? Can we reduce it? Can we make it go away? So that's sort of where I got started in the world of pelvic health. And then of course, from there, I dove more into things like pelvic organ prolapse and diastasis recti. And I mean, I'm sure we're going to get into that. So I specialize, and my team and I, because I have a team of awesome trainers as well, in our group and private classes, we specialize in helping women with these issues.
Well, that's fantastic. And, it's one of the most brought up topics amongst the National Academy of Sports Medicine personal trainers, because, unfortunately, there's only so much you can learn right away in your first levels of certifications. And that's just not something they really hint on a lot, right? There might be a very vague information, but to me, I've later found out with working with some of my pregnant clients that some of that vague information was actually wrong, right? It was very outdated, sort of like wives' tales, no pun intended, stuff that no longer really is in the medical jargon and what they use. So I think it's fantastic that this is something that you specialize in and you're kind of spreading the word. So let's go right into it here. Can you define diastasis recti, and do you consider this something to be rare or common amongst post-pregnancy issues?
So first, let me define it. So diastasis recti, also sometimes pronounced diastasis rectus abdominis, tomato, tomato, it means the same thing. Essentially, every single pregnant woman, I'm saying this slowly for a reason, is going to get diastasis rectus abdominis. The question is, do we get injured through diastasis recti? And I'm going to just call it diastasis recti because it's fewer syllables, or DR, okay? So everybody is going to get it. I did a video on my Instagram when I was recently pregnant with my second. He's now 10 months old. And I am not a huge person. I pre-pregnancy have a 24-inch waist. In pregnancy, I was 9 months pregnant. I had a 42-inch waist. So just think about this for a second. How is your tissue going to expand from being 24 inches to 42 inches? Think of that's huge, right? It's a miracle that our bodies as women can accommodate a baby. But what has to happen is the fascia and the connective tissue has to expand. It has to give. And so there's a part, and really the definition of diastasis recti in Latin means diastasis means separation, recti of the rectus muscles, which are the two bellies of the six-pack muscles in the front center of your abdominal wall. So that has to expand. And the vertical midline of your six-pack muscle is called your linea alba, and it's made up of connective tissue and fascia. It was never together to begin with. So people think it was always closed. It was never closed. There's always, even pre-pregnancy, most people have at least finger's width distance in their midline of their six-pack muscle. It's hard to tell on a lot of us, but it exists. And then it's going to grow. It's going to thin and stretch to make room, right? 24 to 42 inches in a relatively short period of time requires your tissue to adapt. And so everybody is going to have thinning and separating and widening of that tissue, but we don't have to make it an injury. And when I say injury, I mean when you need months and months of rehab or even surgery to fix it. So there's a lot that we can do in pregnancy to manage what we call abdominal pressure. So think about that. A baby is pushing out and creating pressure. It's a pressurized system that your body needs to adapt to. We have to make sure that we're not adding unnecessary strain to that abdominal wall when we train in pregnancy, because the more strain and pressure you add to the existing pressure, which is the baby, the chances are greater that you're going to have a larger diastasis, which is then harder to repair and harder to come back from.
So a term that we use in fitness, and Pilates is used too, is sort of like brace your core, right? So we talk about how if you're doing a core exercise, let's say a plank, pretend someone's going to come from underneath you and punch you in the stomach, right? So you brace all of those muscles and you firm them up. Is that something you don't want to do during pregnancy because that is going to further progress that issue?
So I'm not a fan of the term bracing because it often causes downward pressure. So if you think about it, imagine someone's going to sucker punch you in the stomach. Anyone listening to this, what's the first thing you do? You brace your core, but you also, if you pay attention, you're probably bearing down on your pelvic floor also. Mm-hmm. So not what we want to do when you're pregnant. We have a method, and I teach hundreds of women every 2 months. We have 8-week courses on Pilates and push prep courses. And essentially we teach women to hug the baby. That's what we call it. So it's an exhale, wrapping, you're engaging your pelvic floor gently and your transversus abdominis to really reduce the pressure and to help stay connected neurologically from your brain to your TVA. So we've got something called the law of specificity. If you're going to go and train for a marathon, right? Or if you're a hockey player, whatever your sport is, you're going to train for that sport, correct? When you're pregnant, the same rule applies. You can train for birth. You can train your body to help better manage the load that you're now carrying by growing this human. And the marathon that is, which you're about to find out, my friend, because I hear you have a baby coming soon.
Indeed.
You're going to find out it's a marathon and you can train your body for it. And I really want more women to feel strong. You know, pregnancy is not an injury. Pregnancy is it just requires an adaptation and requires intelligent, specific type of training to really improve your birth outcomes, as well as making it a faster, easier postpartum recovery.
I think that's great insight and a great sort of analogy that you gave, that you're not treating an injury. It's not a client coming in and saying, hey, I pulled a muscle in my stomach, or hey, I have an ankle issue, or hey, my feet are swelling. You're training for an event, and there are so many interconnected issues happening at the same time, not to mention hormonal things going on, right? That are also in turn then starting a snowball effect of other issues. Yeah. Can you speak a little bit to those sorts of things? I would say other common issues associated with pregnancy.
I mean, yeah, it really does vary tremendously by the person, depending on, you know, whatever health issues they may have. I mean, there's so many things that can happen in pregnancy, but if I keep it high level here, something that every woman will experience, you're going to experience often a harder time getting a proper deep diaphragmatic breath. And a reason I mention this is because breathing is so important to helping you manage. I'm going to go back to that word, intra-abdominal pressure. So I will say a couple of things. If you are shorter in stature, you know, if you're 5'2" or under, say, if you have a very short torso, meaning the space between your bottom rib and the top of your hip bone, it's actually your pelvic bone. But essentially, if you have a shorter waist and you're a shorter person, you're often going to show sooner. If you're pregnant with twins, you're going to show sooner. And that usually means there's less room, right? So why is it that a woman who's 5'11" often doesn't show until she's 6 months pregnant, but someone who's 5'2" is often going to show right away? So I'm saying this to say that I've noticed a pattern, and there is no research to back this up, but I've been doing this for a long time, to say that, you know, I use this as a way of also telling women not to worry. They're like, why am I carrying so big? It doesn't have to do with that. It's that your shorter torso is going to make that baby have to pop out further. And I'm bringing this up because we tend to compare ourselves to everybody, right? Well, her bump is bigger and my bump is smaller. It can cause a lot of anxiety. But the breathing, the shorter torso you have also, often you'll maybe feel rib pain. It'll be feeling like every time you inhale, you're short of breath, your shoulders start to hike when you're inhaling. And that can cause dysfunction in your pelvic floor. Because if we lose the ability for the diaphragm to completely contract on your inhale, it can cause a lack of function in your pelvic floor, because your diaphragm and your pelvic floor are like a piston, and they're supposed to live on top of each other. And when you inhale, they both gently open. And when you exhale, they both are meant to recoil back up. And if you are feeling like there's no room because the baby is taking up all that room, your diaphragm often gets impacted. Your ribs can't expand properly, and you're going to start to have poor breathing mechanics. And that poor breathing mechanics can actually add to the intra-abdominal pressure and create issues both with your pelvic floor and your diastasis recti. So the breath is really important. And this is something that I think anyone listening to this, if they want to do one thing to improve their outcomes in pregnancy and postpartum, as well as in pushing, you have to learn how to really harness your diaphragmatic breath and improve your breathing mechanics.
Yeah, that's good insight. And I like how both you and the Belle Method are, you know, obviously synonymous, but you talk about basically this is a wholesale program from pre-pregnancy to intra-pregnancy, for lack of a better term, to post-pregnancy, where some people only look at treating one or the other, right? They're like, oh, I'll go to some prenatal yoga classes, and then, like postpartum, I'll look at these things. But if you kind of look at it from the start, from the get-go, about putting this all together in a wholesale approach, you're going to come out in a much, advantageous fashion.
Yeah, I mean, I taught a class right before I hopped on this podcast with you, and I had women in that class who had one woman had a 5-month-old, and then I had some women in their 60s. Like everybody was benefiting from that class, right? So it's not just, and that was a regular belt. It was the hardest class, and you can continue to benefit because we're talking about all these things. Like I love that you brought that up. It's not just pregnancy and postpartum specific. So a lot of people are like, well, why do I care about, I hate that I have to think about my breath so much since I've had kids. I didn't have to think about this before. And maybe you weren't having to think about it because you didn't have diastasis and pelvic floor issues or anything like that. But as we age, even if we haven't had children, these become more important issues to really manage, right? Like in terms of gravity, if you think about it, think of dogs and cats. They're on their hands and knees. They don't have the same, or hands and knees, they're on 4 paws on the floor. They don't have the same gravitational force as bipeds. We stand up. And I think the stat is crazy. It's like 2/3 of women are going to develop some type of pelvic organ prolapse by the end of their life, at some point in their life. And so we need to work proactively, again, whether you've had children or not, to really incorporate our pelvic floor into all fitness. So I wish the pelvic health wasn't just relegated to pre and postnatal. I wish it was something that everybody felt comfortable talking about instead of just glazing over.
Yeah. I want to talk specifically. You mentioned earlier, my wife is pregnant, and one of the issues that she's having now is she has sciatica, very bad sciatica. It comes and goes like most sciatica. Majority of my previous pregnant clients have encountered this at some point. Again, this is far from my expertise, but I would say typically it seems to be more in those middle months, middle to end, not in the beginning. And I don't know. And this is what I'm going to throw to you. Do you attribute that to things shifting? Do you attribute it to the front weight having sort of a messing with the pelvis? What exactly is the scientific reasons behind why the sciatica could be more activated during that 2nd and 3rd trimester of pregnancy?
I mean, it's interesting you say that because I never experienced it. And in our classes, we don't have many issues with sciatica, to be honest. I'm sorry that your wife's going through that. It sucks. And I know it's painful. Our pelvis shifts less than we think. I think that's a bit of a myth that people think, oh, your bones are shifting, your pelvis is unstable. And we've often used that as a reason for why women develop symphysis pubis dysfunction and sciatica and all these pain issues. But it's less of that type of an issue. It could be a gait issue. The way she's walking has changed. It could be just a generalized postural change. Not that the bones are shifting, but she's, again, carrying weight differently. Also weakness through the glutes because the weight of the belly is pulling you into more of an interior position. You often get weakness through the backside of the glutes. And we know that the sciatic nerve runs through the piriformis. So as you know, anything we can do to really floss that piriformis can be helpful. Short of we wouldn't want her to be experiencing shooting pain down her leg when doing the work that we would prescribe, but rolling the piriformis, lots of clams, side leg series, bridges, anything we can do to really get that muscle firing is going to help her feel better than what she's currently dealing with, for sure.
Yeah, that's great information. And as far as, taking care of the sciatica once it arises, I have a good handle on that. But to make sure the sciatica doesn't arise in the first place, I think maybe she needs a little bit of the bump method.
Have her give me a shout. Absolutely. Yeah. Happy to have her. But yeah, a lot of it is, I think I would just, to answer your question, weakness throughout the gluteal muscles because of those postural shifts is often like the real culprit, in my opinion.
Yeah, that makes complete sense anatomically. So let's talk about maybe some specific exercises. Are there exercises that people can do either at home or with very little equipment to whether it's circumvent the diastasis recti, let's just call it DR for now, since we're both pronouncing it differently, the DR, or to help postpartum DR issues, maybe get that 3-finger back down to the 1 finger?
Yeah. And I want to just clarify, a lot of us get hung up on the finger width. So we know now in the research, it's less about finger width and more about tension. So essentially you might have someone, and I've had clients with that only have 1.5 finger width, but I can, when I test them, literally put my entire finger inside. That's more of an issue than someone who has a 3-finger width, but I can only get my fingernail in. So again, we want to make sure that you can't get your finger in deep, because that's more of a sign of weakness and tissue laxity than like the space or the width of the gap. So anyways, I had to get that out there. But yeah, there are tons of exercises that you can do without any equipment. And that's actually what our classes teach. So it's Pilates based, but we also incorporate a lot of stuff that you would see even in physiotherapy, sport medicine clinics, which is actually where I got my start teaching. As soon as I got my certification, I was at a sport medicine clinic. So I learned a lot pretty quickly about the things that people were being prescribed to do after they got injured, but there's no reason to wait until you get injured. We can do these strengthening exercises proactively, and we make them fun in the context of a workout. So it's not just boring physio, right? Like we can make this interesting for people. And so that's what we're doing. Like I mentioned, I mean, I could list a bunch of exercises here, but I think the point is that we really want to be proactive. We want to work on a lot of those muscles that often need a little extra love, like piriformis, glute medius. Glutes in general are really important to work in pregnancy. And then that diaphragmatic breathing. People say, well, I want to do core work. How do I do abs when I'm pregnant? And my answer is you want to do your diaphragmatic breathing, and you want to learn how to do the hug the baby. And I've got videos of this online. Essentially, it looks like you inhale, oh, wow, she's 7 months pregnant. Exhale, she's going to wrap her core. And all of a sudden, where did the bump go? It disappeared. She's now 4 months pregnant. So it's kind of a fun party trick as well. And that's what we teach in our classes.
Don't brace, hug the baby. I have to say it one more time to myself so that I remember that when I'm working with pregnant clients or with my wife.
Mm-hmm.
I want to talk about trainers and if their drive, their niche is in this field. If they want to do what you do you have any advice for them? Do you yourself teach a certification to help them out? And if not, why not?
I know I'm working on it. Actually, you can sign up. We have a wait list. It's called the Pelvic Health Mastery Course. I'm building it. It's an 8-week course, and it's on the homepage of thebelemethod.com. If people want to sign up for the waiting list there, they can. It's been delayed because of COVID. So we had 12 locations I was teaching, and my team and I were teaching across the city of Toronto. COVID happened. I was 36 weeks pregnant. And when I was 36 weeks pregnant in the middle of this pandemic, we had to cancel all the classes, and I had to quickly pivot everything online. And so the pelvic health course got pushed to the back burner because I had to serve the clients and create online courses for like actual pregnant women. And so that's the delay. I feel like I've been talking about this pelvic health course for a long time, and I had to explain why it's been so delayed. That's why. But essentially, if you are looking to start, I always suggest people get their basic certification first if they don't already have that. Whether that's through ACE, whether that's as a Pilates instructor, your 200-hour yoga teaching trainer, get something, and then start to really figure out what niche you want to work with and keep doing courses. So like I said, I've done dozens of courses, and my plan for this 8-week online pelvic health mastery course is to literally give all the information that I've learned across the board over many years and put it in sort of the easiest digestible. Because I've found that if I do a new course, I'm lucky if I walk away with something that's new. 20% of the material is new. That's a win, right? There's a lot of repetition in a lot of the courses that we've taken over the years. I'm sure you can agree. So if you get something like a nugget of wisdom that you want to hold on to that you can actually apply to your clients, that's gold. And so I'm hoping to create a course where it's all the nuggets of wisdom that I have learned to really help people feel more comfortable dealing with the pre and postnatal population.
So forget about the official release from a doctor. If somebody is, let's say, 6 weeks post-pregnancy, how do they really know if they're ready to work out? What are the telltale signs that my wife can look for? And I know, obviously the vague general answer is everyone's different, but you specifically, just give anecdotal experiences. How did you know that you were ready to start working out? And then when you do start working out, what sort of exercises are you doing to kind of climb back up that mountain?
So let me just get this on record. Waiting 6 weeks is not smart because it's arbitrary. And I have a good friend of mine who's a urogynecologist and OB. And I asked her, I said, listen, doc, what's up with this whole 6 weeks, do nothing? And she said, do you want to know the truth? I said, yeah, I want to know the truth. It takes 6 weeks for stitches to dissolve. That is the only reason why there is a 6 weeks, get your clearance. And I have to be honest, having just had my second baby in this pandemic, now some of these checkups are virtual, okay? And they do not cover diastasis. They do not cover incontinence. It's like, you're good to go. And a lot of it has to do with you're good to go and you can go have sex with your husband again, which is not helpful, I have to say, when it comes to talking about like what's actually going on in your body. How are you healing? And then it's like, it's basically the equivalent of doing nothing for 6 weeks and then going and trying to run around the block. That's like getting ACL surgery, doing nothing, and then trying to go back and play your sport. It makes no sense. So we actually recommend starting the week you deliver with core breathing, with gentle diaphragmatic breathing, with a few bridges when you're lying in bed, with gentle mobilization exercises for your ribs. The idea of doing nothing and then getting arbitrarily quote unquote cleared at 6 weeks and then going to Beachbody is super dumb, just super dumb. I get really upset when I talk about this stuff.
No, listen, it makes perfect sense. I mean, why would anybody try to limit movement as a whole for somebody who is sort of post-injury, post-op? It is essentially an operation, right? So, or it could be if it's a C-section. Yeah. So I think you want movement, even if you said that movement is just simply breathing and bed bridges and getting up properly and working on postural alignment and the small things to make sure that you are building back up and ready to go instead of laying around for 6 or 7 weeks because that's what the doctor told you to do, and then just jumping back into it. That would seem to be misguided information.
And you're doing, like, it's work. Mom life is work. Picking your baby in and out of a bassinet is work. Carrying a car seat is work. You're actually exercising in the context of your life, and yet not doing anything to really help rebuild that brain pelvic floor connection. When you're pushing a baby out, the axons in your nerves are stretched to a point where there's always going to be some damage. And so that's why you get muscle inhibition, brain neurological inhibition. You try to do a Kegel right after you've delivered a baby and you're going to be like, holy crap, I don't feel it. I don't feel anything. It takes time to rebuild that connection. Start soon. Start right away. And this isn't meant to stress people out if they're listening to this and they're like, crap, I had a baby 6 months ago. I didn't do any of this. It's not too late. But if you are expecting and you are wanting to really help, your recovery, this isn't me saying, don't be lazy, do your thing. This is literally go take a shower and breathe in the shower, but be mindful about what you're doing rather than doing nothing and just jumping back into exercise. And then often, one of the stories I hear often is women do nothing, they get quote unquote cleared, and they're like, okay, awesome, I was gonna go, I really missed working out. So I was really short on time, so I just decided to go for a quick run, and they pee their pants and they're devastated and they feel broken. And then they're afraid to do any type of exercise because they think they're broken.
Yeah, well, that's great information. And not only for people who are going to be going through the pregnancy, but for the trainers. I mean, if, thinking of myself 10 years ago as a 25, 26-year-old trainer, at that point, I had known nothing about pregnancy. None of my friends had yet had a baby, right? So I hadn't heard these anecdotal stories from my friends. At that point, I was training mostly people over the age of 50. So I wasn't dealing with people who were dealing with recent pregnancy issues. So coming upon that first or second or third client who had recently had a baby was, a complete nightmare. I had to do my
the honesty, Steve.
Yeah, I mean, because if you understand that there is trauma here, both physically and psychologically going through this process, and whether they downplay it or not, you as a trainer really have to do your due diligence and dig into these things and maybe even say at some point, hey, I'm not fit to do this. This is above my pay grade. That's also fine, right? Because you are a specialist in this, right? So if my wife is having some issues, I much rather send her to you than pretend that I know it all. And that's something I talk about. I always shamelessly plug my book in Fitness Business 101 is that it's more important that you do the right thing for your client, right? So you want to network, you want to have a sports medicine doctor and a pelvic floor expert and a physical therapist and somebody who specializes in ankles. And it's not because you don't potentially have the skill set to do it down the road, but right now it doesn't benefit your client if you have a general knowledge to give them general information, right? They need a quote unquote expert, and you should do the right thing and pass them off to one.
Absolutely. And just to add to that, I do recommend that all women, even if you have no symptoms, see what we call a pelvic health physiotherapist. In the States, it's called a physical therapist. It's the same thing. Mm-hmm. So it's pelvic health PT. You need to see a pelvic health PT, if possible, during your pregnancy. and then postpartum. And you will likely get more information from a pelvic floor PT than you will from your OB, especially postpartum when you're healing. And what that is, it's an internal vaginal and sometimes, believe it or not, rectal exam to make sure that when you are engaging your pelvic floor, you're doing it right. A lot of people are doing their pelvic floor exercises, AKA Kegels, and doing them totally incorrectly. Sometimes women have tension in their pelvic floor, and they think, unfortunately, that doing more pelvic floor up training is going to help, but the weakness in their pelvic floor, their bladder leakage, might be caused by tension. And here they are trying to do Kegels to help it, and it's actually making the problem worse. And so we work very closely with pelvic health PTs to refer back and forth, like you say, because I'm not giving internal exams. That's, again, outside of my pay grade. So There you go.
That's great information. I think people will sort of cling to monikers that are very high, right? If somebody is a doctor of some sorts, they assume they're going to know the most. My wife is a doctor. She's a pediatric sports medicine doctor. She'll be the first one to tell you that she has a scope and she doesn't know things outside of her scope. And I think for me, I had finger surgery about 2 years ago, and the occupational therapist that I work with seemed to me to know 3 times more than the surgeon about my finger, right? Because he doesn't know the process that happens after that I'm released. He knows whether maybe he checks in with me 6 months from now to see if the occupational therapist's advice and techniques had worked, but he doesn't see the recovery process that I'm in, right? So that having these people who are there and specializing and seeing the recovery process over and having all of these experience, 10s and 20 a day, right? So thousands over the course of their career is really what's important, because they see the nuances, the subtle nuances of ways to tweak things to benefit you.
Totally. I just wish there was more integration, right? Like, I wish it wasn't. A lot of women constantly, one of the common DMs I get is, how do I find a pelvic PT, or how do I find this type of an expert? And I just wish that the OBs were talking to the pelvic PTs, who were talking to the trainers, who were talking, like, we all need to be talking to each other to really better serve the patient or the client.
So forgive my naivety. It's not automatic. You're not sent to one post-pregnancy, regardless of if you may have issues or not.
Are you kidding? Women have to really advocate for themselves. I mean, one country I know where it's included is in France. God bless the French. They have, vaginal rejuvenation therapy is kind of what they call it. But really, that's the only country I know of where it's actually included in, like, the healthcare system. Here, a lot of the times, I know in the US, you need to ask for a referral from your doctor if you want it to be covered through your insurance. And for most of us here in Canada, where I'm located, you just have to call. You don't need a referral. You just have to know to even seek out a pelvic floor PT.
It seems absurd that I had, a centimeter of my tendon in my pinky reattached, and I went through 6 weeks of this, which was mandatory. And somebody gives birth to a 10-pound baby, and they have to, basically,
advocate,
fight the doctors to get into this. I didn't know that. My best friend and his wife, who just had a baby 6 months ago, she is seeing a pelvic floor specialist.
Good.
And I was under the impression that she was forced to do that, or that she was forced is the wrong word, that she was given the opportunity to do that without having to advocate. I didn't know it was otherwise. So it's a shame.
And it's, unfortunately, a lot of it's normalized, right? Like, even, some of the ads that you see on TV where it's like trying to normalize this whole, like, I'm a mom, I pee my pants, or like even just the like poise pads. And I've worked with this brand before, so I'm not saying that it's wrong to use a pad if you're leaking. It's just that that's not a lifetime solution. There's things you can do. That's not your future, like there's a lot you can do on the road to recovery. And so I think it's great that we're trying to talk about it more and destigmatize, like, oh, you're leaking, but I don't want to normalize it too much so that women think that, oh, I'm peeing my pants, it's just normal, I just have to deal with it. And they don't even tell anybody because they think it's normal. It's like, even the tiniest little drop of unwanted leakage is incontinence. People think, oh, it's just a little bit, it doesn't really matter, it doesn't really count. It all counts, my friends. And the prognosis, if you're leaking now, if you're still leaking 3 months postpartum, that's a big problem. Like, we really want to make sure you're seeing a pelvic PT to really get to the root cause of why you're leaking, because you can be leaking for so many reasons. The answer isn't always just you need to learn how to work your pelvic floor more.
Yeah, well, that's great information. We're going to shift gears a little bit. I'm going to ask you something selfishly. So my wife, again, she's due in July. post-pregnancy, let's say the kid is the girl, it's a little girl, 3 months, 4 months, 5 months, 6 months. How does she then get back into the groove of working out? And then we talked about sort of the medical side of this, right? What's going on with your body. But from a day-to-day standpoint, obviously you deal with mothers who are, and you yourself had to deal with this. Do you have any recommendations and tips on how a first-time mother gets back into like, I guess you would say like managing and controlling her schedule so that she can exercise?
No, all the help. You better be helping her. So she needs help. And I think this is the one thing too. It's very difficult, to make time. And I always have to say, reset your expectations. 10 minutes counts. The chances are high that you're not going to have an hour of uninterrupted workout time to do 4 days a week, so you might be struggling with a lack of energy because of being up and breastfeeding and all these things. Like there's going to be a lot of additional hurdles that you have never had to deal with before. So show yourself grace, ask for help, and know that 10 to 15 minutes counts. And in the research, they say that specifically with core rehab, 20 minutes 3 times a week is the minimum you need to get results in the research. 20 minutes 3 times a week. So if that's what you do, you're rocking it. So again, just recognize that this is a phase, this is a season, it's not forever, and show yourself some grace and ask for help.
Nikki, this was fantastic information. Can you tell the listeners where they could find more about you and the Belle Method and the Bump Method and all of your information?
Sure. So you can check me out at thebellemethod.com, and it's spelled BELLE with an E on the end, and the Belle Method on Instagram. And just let me know how you're doing. Send me a DM. You can use the contact form on the website. We've got lots of classes for pregnancy. We've got 8-week courses that are live on Zoom, and you also get the recording, so you don't have to actually join live. For postnatal level 1, we have a level 2. We also have I call it Pilates on crack class. If you want something really challenging and you're not pregnant or postpartum. And I'm just about to launch a new workshop. And for anyone listening who might be short on time, and I get this all the time, women are like, I'm 35 weeks pregnant. What do I do? I don't have time to do your 8-week course. We're doing a quick 2-hour birthing without fear and pushing without fear workshop. So that's coming up, and it'll be happening mid-April as well.
Fantastic. Nikki, thank you so much for being with the Trulyfit Podcast, and we hope to speak with you soon on a different topic.
Sounds great. Thanks for having me.